name is Rebecca, and I've been an ultrasound tech for 2.5 years now. What I love most about being an ultrasound tech, I think, is the difference every exam has, meeting new people. You never know what you're going to expect when you go home to work. It's something new every single day. I love being someone that patients can talk to and have an open ear when something in their life is bothering them, and that they're comfortable when they're getting a small exam done. The way I try to make my patients feel seen and that they're not a number is really take my time with each patient, not looking at the clock or rushing through the exam, just each patient, treating them how I would want to be if I was getting an exam done, and making sure I'm really listening to everything they have to say. I started with RadNet in Rancho with my manager, Rick, as a part-time night shift, and that was about 2.5 years ago. A year from there, I transferred over here to a full-time position at Corona with my manager, Martha, and then now Kim. When I graduated ultrasound school, COVID had just started. So I actually didn't work for about a year, and in that year, I took a test called the SPI. That test is needed to start your career. It's the physics, the hard stuff. So once I got that test, I started applying to every RadNet I could, and that's the one that picked me up. RadNet is a great company to start off at that I've heard from teachers and co-techs that I met throughout clinicals and everything. From what I heard back then and have now experienced, RadNet really trains you in what you need to learn and can create a solid foundation for your career as an ultrasound tech. There's so much room for growth in so many different avenues in this position as an ultrasound tech. You're not confining yourself into one specific thing, and that's something that really attracted me to the job as well, because I don't want to be bored at work, so every day is different, and I think it's a great choice for a lot of people. The people I work with are awesome. We've created a really solid team here. This location has 6 ultrasound rooms, so it's really busy. We have our breast and women's center, and upstairs we have general, and now we're growing and also having OB greater than exams, which we haven't had at this location for a couple years. So we're all working as a team to learn all the exams. Whoever doesn't know, we're taking turns getting trained, and we can get really busy, and we all seem to help each other picking up exams, and yeah. It's awesome. Off the top of my head, an experience that I've had that made me feel like I am making a difference is whenever a patient wants to give you a hug after an exam. I know some people might think that's a little too close for comfort, but whenever a patient was touched that much by me or the experience they had, that really encourages me that I'm here for a reason and my job does matter to these people. I'm proud of what I do because after COVID and not scanning for a year, I had a struggle of a time to get back into my skill, and it took a lot of people in RadNet to help me out and get me where I needed to be. So now in my career, what makes me the most proud is when I see a student that really cares about what they're doing here and the career that they aspire to have. I get to be there for them to help them perfect all their skills and get ready to have this career on their own. And I now have a coworker that was a student, and I just love seeing her get to do what I taught her to do, and that's my proud moment for sure. To my fellow rad techs, I think we just can all remember what we're here to do is just serving and helping other people in their journey of health or wellness, whatever they're going through. And just if we start our day remembering that, it can be a positive, good day every day. And that's what I try to do for sure.